Branch of medicine that exists where a dead organ is left in, except in dentistry where a root canal is left in. If a guy's got a gangrenous toe, you gotta cut the toe off because it's bacterial infested and it's toxic and it's gonna kill the patient. If you think that you can get away with an infected toxic tooth and not have a systemic consequence, I think you're deluding yourself.
What if I could tell you that 98% of women that have breast cancer have a root canal tooth on the same side as their offending breast cancer?
What if I told you that the biggest toxic influence in the body in a chronically ill person is a root canal tooth?
What if I could tell you that the leading authority in cardiovascular prevention, which is Balan-Donine, does not condone root canals in your mouth because of the bacteria?
Of the people that come to see me with chronic illness, the question is how many of them have a dental etiology to the cause of their illness? I would say almost all of them.
The vast majority of chronic degenerative diseases begin with problems in the mouth, infections and toxins, and it's only until those are addressed that you're going to get any clear positive response with your disease.
I had a gal come in here who was early 40s, very fit, very nutrition conscious, and she came in here because she had severe, horrible back pain. In fact, the first day that she walked in, she had a 4-pronged cane, bent over, and she was on full narcotics round the clock for her chronic pain. And she sat down and she wanted me to do some injections on her back to help her alleviate the pain. And I said, I'm happy to do that, but let me just dig a little bit about what could have happened to you. And she said, well, I got back pain. I went to an orthopedist. The orthopedist said he did an MRI of my back, said I had a herniated disc, did surgery on me to remove the disc. About 6 weeks later, I was worse. The orthopedic surgeon did another MRI on me. He said the disc had moved more, that I needed to have a laminectomy at 2 levels. And he took me in and he did a laminectomy at L4 and L5. Laminectomy means the back half of the bones on the spine are pulled off so that there's more room for the discs and more room for the nerves. At which point I saw her and she was worse. And what came up on the examination that I did, that she had some inflammation in her jawbone. I said, did you have any dental work done prior to this back pain? And she said, well, come to think of it, I did. I had an infected tooth. I had a root canal done. The root canal failed. I had another redo of the root canal. It also failed. I had the root canal tooth pulled, and I had a graft put in there, and I had an implant put in there. So I said, let's do an experiment in the office. I can inject a local anesthetic on that tooth. If your back pain is related to that tooth, and I block the nerve coming from that tooth, it may make your back pain feel better. And that may be the reason for your pain, because after 2 failed surgeries, another one, the chances of it working aren't very good. So she said, I'm in. So I took some local anesthetic and I injected her tooth, and I waited about 15 minutes. And when I came back into the room, she was standing up going like this. I said, how does it feel? She says, it feels 90% gone. I said, then probably this is linked to that tooth. I just want to make sure. You come back in 3 days, we're going to do this again. I want to make sure that just as a relief reaction, sort of a mental, this is all psychosomatic and it's gone. We did it again. And she said, it's gone. I'm going back to the oral surgeon and I'm going to have him take the darn implant out. Within a couple of weeks, her back pain, except for what was leftover surgical trauma, was gone.
Well, root canal procedure is still a very, very popular thing in dentistry because no one wants to lose a tooth. But more and more people are beginning to realize, even from the current day modern and very traditional literature, that it's impossible to sterilize a root canal system.
Most conventional dentists believe there's no problem with them, but I personally couldn't disagree more. I think that they're a hidden source of toxicity for almost anyone.
The reason that root canals have an inherent problem is that because we know that nowhere else in the body can we leave dead tissue. Anywhere else in the body, your appendix dies, you have dead tissue that doesn't heal in any other area of the body, we know we have to remove that because it's a haven for bacteria and it's not compatible with health. And the same is true in a tooth. A tooth is a living structure, has a blood supply, has a nerve supply. And so when a tooth dies or becomes infected, and we decide to go in and do a root canal, even the best endodontist or root canal specialist can do a great job at cleaning out the main canal of any of the teeth. But what they can't get to are all of these thousands of tubules. You could see if you cut a tooth in half or under a microscope, you can see these thousands of tubules that run out in every different direction at all sorts of angles off from the main canal.
Those microtubules are big enough for a bacteria to fit in, but not much else. And the problem is if you've got 6 to 8 miles of microtubules in a single tooth, it's impossible. You can see why it's impossible to sterilize that tooth.
So, after the root canal has been performed, unfortunately, bacteria still reside within the tooth. And now you have this nice, warm, incubated tooth where the bacteria are able to flourish. And now there is no access from the patient's own immune system to the tooth because in the process of doing the root canal treatment, the blood supply and the nerve have been severed from that tooth, so now the body can't deliver its own immune defenses to help keep the infection in check.
70 to 90% of all medical problems actually originate in the mouth. Conventional dentistry still has a focus on the mechanistic Newtonian mentality that the teeth are not connected to the rest of the body. I mean, embryologically, the teeth develop from the same tissues that gives rise to your sympathetic and the parasympathetic nervous system. The blood supply and the mouth literally will take any toxins via the lymphatic system and take it down to the thyroid, the thymus, the heart, and the rest of the body. So there is a direct connection.
The teeth is not just like a stone in the mouth. It is extremely densely connected. The pulp is extremely densely connected to the lymph system, to the autonomic nerve system. More than any other organs, it's connected to the afferences, the sensitive nerves to the brain directly, and to all meridian systems.
Every tooth connects up energetically through the meridian system to certain organs and glands. So for example, on the upper side of the jaw, the last 2 molars and this bicuspid actually connect up energetically to the left breast, and on this side it's to the right breast. And 95% of the time, women who have breast cancer who undergo a thermographic study will be found to have hot spots in the jaw on the same side as that malignant breast.
97% of our breast cancer patients in an age between 30 and 70, we tested all these patients, they had a root canal or a toxic situation in the teeth.
The discussion of the energetic relationship of the teeth to the rest of the body is very interesting. Every tooth lies on a specific acupuncture meridian, relates to certain organs and tissues and vertebrae and muscle groups. And so very often you can see a direct relationship. For instance, there was a 19-year-old girl, her first year in college. She had a root canal on a front tooth. That front tooth relates to the kidney and the bladder. She started to have bladder infections and kidney infections. She tried every treatment known, and she was constantly going on antibiotics, and nothing helped. When she came to me, when I tested that root canal, I saw the direct relationship and told the mother, and it was very hard because here you had a 19-year-old girl and it was a front tooth. But I said, I think in this case, that really the thing that needs to be done is to remove that tooth. Well, they didn't want to hear that, so they went and tried other treatments. And then about 3 months later, still suffering from chronic kidney problems and urinary bladder problems, she took the tooth out. And that was the end of the problem.
I remember years ago having a physician say, I can't buy into this concept of this electricity going through these meridians. I've never seen a meridian in all the cadaver labs I've ever been in. And I said, okay, when you can do an EKG on your cadaver, I'll be able to show you a meridian, because you can't find it when the person's dead. When you're looking at doing an EEG or an EMG or an EKG, we're looking at the electricity going through the body, and that is completely mainstream. Each tooth actually lies on a different meridian. So those energy pathways that we discussed, they go through particular areas. So if we're looking at the wisdom teeth, we're talking about a small intestine and a heart. As we move forward on the top and we have these molars, then we're looking at breast, we're looking at thyroid. On this side, we're looking at pancreas. On this side, we're looking at spleen. Then we move forward to the bicuspids and their lung and large intestine. We go to the eye teeth, and it's called an eye tooth for a reason, because it's connected to your eye. It's also connected to the liver and to the gallbladder. And then these four front teeth, top and bottom, are connected to the urinary tract, to the anal canal, to the adrenals, to the pituitary, to your kidney, everything that's related to that urinary tract. I use a piece of equipment that was originally called EAV, electroacupuncture according to Vol. I put electricity into the body, and then you gather data from that. So when I'm testing teeth, I actually have the person holding a bar in their hand, and that bar is the collection point, and they touch a tooth and put it in the circuitry, and then I introduce, by touching on a particular acupuncture point, I introduce the electricity into the body to see if it can go all the way through that meridian. And you start seeing where electricity is being blocked, and now you start asking questions about the person's health, and they go, wow, how did you know that? I didn't even tell you that I was having problems there. Because when the electricity can't get through, it compromises that meridian.
Many people have trouble getting their mind around the fact that their teeth are making them sick. But let me just tell you that a year or so ago, we looked at the last 60 cancer patients that we had seen, and 96% of them had an infected tooth in the same power supply circuit as their primary cancer, 96%.
A whole person's jawbone. And it's interesting how, as treatment goes on with the gas, they feel that area where it's going off into is shrinking.
This jawbone area has a very dense nerve network. These nerves don't relay. You know, it's not like here goes to the spinal cord or somewhere else. These nerves go right into the middle of the brain where the regulation of the nervous system occurs. They're called cranial nerves. This cranial nerve is the biggest one in the body, and it goes right into there. And this is a very delicate and protected area. So that if someone has a chronic smoldering infection with biotoxin in this area, it can affect their brain, the regulation of their brain, their energy, and lots of other things.
For example, we had a woman with so-called Hashimoto's disease, an autoimmune problem, and it was coming from a cytomegalovirus from a third molar extraction site in the jawbone, plus nickel ions from an orthodontic retaining wire. Once those two substances were removed from the thyroid and the sources, the Hashimoto's totally disappeared. So autoimmune problems are there for a reason. The body doesn't attack itself for no reason. There's something there that's causing that reaction.
So the doctor has to be alert to this, because if he wants cures, especially with cancer, you've got to address these. They're big stressors on the body, and they take a lot of immune attention. And if the immune system's like, don't let the toxin get into the brain and kill me, it's letting the cancer cells go here, or men in the prostate, or in the colon, you know, the big ones, or in the lung. These are the four big cancers.
Your chance for cancer is significantly increased. And it's just spreading out of the ignorance of the so-called specialists that they don't want to accept this fact, even though it's absolutely clearly proven.
So in doing the testing of the bacteria, we found that there are, in root canals, 53 different bacteria. 28 of them are directly involved with the health of the heart. that they are known from the scientific literature to create certain heart conditions. Some of them specialize in attacking the heart valve. Many of them cause what's called endocarditis, inflammation of the vessels inside the heart.
And we now have studies from the Journal of the American Dental Association that show that when you have one or more root canals in your mouth, statistically speaking, you have a greater chance of heart attack, plain and simple.
We know with increasing evidence that the cause of coronary artery disease is inflammation of the endothelium, the lining of the blood vessel wall. What we need to do in medicine then is work out what is inflaming the wall of the artery, because ultimately what the body does is the body tries to seal off the inflammation. The body uses cholesterol, it uses calcium to seal off that inflammation. You're getting what's called a plaque. The same plaques that we get on our teeth, which is basically bacteria covered by a biofilm, then covered by a layer of calcium, is exactly what we're seeing in coronary arteries. So the trick is not to try and get rid of that cholesterol, which is going there, is being put there by the body to protect us against the inflammation. The trick is to try and work out what is causing the underlying inflammation. Dental infections are a big part of that because of the seeding of bacteria from the mouth straight into the bloodstream, then to the coronary arteries.
This is a process that can occur in a person, and it can be undone if it's done properly by a doctor who knows what they're doing.
We do a test for all these organic toxins where we can see if the body is, so to say, impregnated by these dental toxins which come from the root canals. We can measure these, we call them xenohormones, cancerogenic substances which are organic molecules.
Once we have the basic toxic source removed from the patient.
Another blockage, this time in one of my wisdom teeth. I dug deeper and got a cone beam scan. I was told it was a cavitation, something else you really don't want. Just my luck. I had to get that sorted out now as well. Step one was actually finding out what a cavitation is.
Cavitations are basically residual infections in the jawbone which result from extraction of teeth. If the extraction site is not meticulously curetted and cleansed, the bacteria just infiltrate into that wound and live there for the rest of the life of the patient.
Every bone in your body is connected to another bone by way of a ligament. Your tooth is connected to your jawbone by way of what we call a periodontal ligament.
If a tooth is properly pulled, when the tooth is out, the dentist will also take out that ligament. And if that ligament is gone, that bone will heal in so that there is full bone and you have a restored jawbone. But if the doctor pulls that tooth and doesn't take out that ligament, that space where that tooth was may seal over on the top and be a cavity.
So that periodontal ligament staying in the socket, it prevents communication from the body being able to send the osteoblasts and the osteoclasts to that extraction site and fill in with healthy bone. It becomes a barrier.
And it will be a place where the body then will use as a storage depot for junk, toxic junk, bacteria, funguses, and it won't hurt. It may not be completely visible on a regular x-ray, but it is sitting there.
So the periodontal ligament prevents healing. One actual study on 5,000 cavitations left after wisdom teeth were removed, 4,999 had not healed. Only 1 in 5,000 had healed.
The majority of people in the United States and in the developed countries around the world that have had extracted teeth for any reason also have cavitations. And what's inside that hole is nothing different, and this sounds disgusting and it sounds like an exaggeration, but it's not. It's the same as wet, infectious gangrene.
These cavitations in the jawbone, they can create significant diseases, significant neurological diseases, like, for example, MS.
But that cavitation can occur from different things. For instance, a person could have a clotting disease, or they could have had a football injury, something that made the bone not be healthy in that particular area. The most common reason is that the tooth was removed and the periodontal ligament was not taken out, and therefore that void of where the tooth was never did fill in appropriately with healthy bone. The second most common reason is that that bacteria that's in a root canal tooth will find a microfracture through that particular root surface and kind of wormhole through the bone and create a void. And so it's not uncommon for a cavitation to occur next to a root canal. The most common spots are the wisdom teeth.
The wisdom teeth are unique in that there are 4 circuits going through it instead of just 2. It's heart, small intestine, and the sympathetic and parasympathetic systems. And so you see people whose adrenal glands are not working, and it's because they have infection in where their wisdom teeth were taken out, because you can have infections in the bone where your wisdom teeth were taken off for 50 years and essentially have no pain there, but it completely destroys your life.
For instance, I myself had my wisdom teeth out when I was in dental school. About 30 years later, I developed a heart arrhythmia, and nothing seemed to help it. I would take intravenous vitamins, I tried homeopathics, nothing was doing it. And all of a sudden I said, wait a minute, let me check, see if I have a cavitation. That wisdom tooth, which is on the heart meridian, you see, was causing the problem.
If you can get a good normal 3D cone beam x-ray of your jawbone, then you do have a much higher reassurance that you don't have this cavitation process going on inside the jawbone as well.
And if the dentist unroofs that and scoops that stuff out and then removes that ligament and then that heals, that patient can get well.
One of the questions that we get is, are there things I can do prior to my procedure to increase my ability to heal properly from a surgical procedure like a cavitation or from a root canal removal? One of the biggest things that you can do is to have proper nutrition, be eating a clean diet, be getting enough proteins and enough vitamins and minerals.
When that tooth comes out, you want to make sure that the socket is cleaned out really well. You want to remove the periodontal ligament. If there's infection, you want to get rid of the infection, and then you let it heal. I like to let the body fill it in with its own natural bone. You have to wait at least 3 months for that. You want to check it and make sure that it did heal, that you don't have the cavitation. But let's say it's healed. How do you replace the tooth? Well, you have different options. Of course, an option is you don't replace it, you leave it alone. Another option is you can use something removable, which most people don't like. It's not very comfortable. The other option is you could put a bridge in, where you're bridging that space. And there are 2 types of bridges. The traditional bridge, which I don't like, is where you have to mutilate the teeth on either side of that space to hold the missing tooth. And the problem with that is when you mutilate those teeth, you increase the odds that those teeth could need a root canal in the future. So I prefer to use a bonded type bridge, where the abutment teeth, as they're called, or the supporting teeth, have minimal preparation, and that holds the missing tooth. Now, the only downside with that really is that it periodically will come loose and need to be re-cemented.
Now, of course, the best option is to take really good care of our teeth and gums with a comprehensive dental program, so we never need a root canal. But let's say that hasn't happened, like me and a lot of other people I know. Let's say there was trauma involved and you didn't get an option, can't really walk around with no front teeth. It's not very good for business. Am I going to have some sort of bridge? Am I going to have some sort of implant?
An implant is where you're going, and you're going into the bone, and you're placing what traditionally has been a titanium implant. Now, today, we have also ceramic implants. The advantages and disadvantages, well, titanium, the problem is you're putting a metal into the bone.
Titanium itself is known as a hapten. It means the ions in the titanium itself can trigger autoimmune. So if you are genetically predisposed to something like Hashimoto's, celiacs, scleroderma, lupus, rheumatoid arthritis, it might get turned on, and even if that implant is removed, the trigger's already been pulled. So now you've got problems that you didn't have. Plus, I've got metal that is directly going into my meridian system. So it's like sticking a spoon in an electric socket and bending it around and sticking it in the bottom part, and it shorts out the whole meridian.
What we're finding is that many physicians that are referring their patients here, and also patients that are doing their own research, are desiring to have no metal in their mouth. They want to eliminate anything that could create a current, and that's why we now have zirconia implants, which is, it's more like a ceramic. It's a complete non-metal implant that looks the same as a titanium implant and functions the same, but is considered much more biocompatible for the tissue and for the patient.
And it interferes with the body much, much less than titanium implants. I do not say zirconium implants are 100% good, but they are much better tolerable to the body than titanium implants are.
So good medicine would include this, and that's what we want to do. We want just the best medicine. We want to give people things that don't hurt them more than they help them.
Root canals are probably one of the most pernicious, toxic, hidden influences on your health. And if you're struggling to understand why you're so sick and you have multiple root canals, please examine that issue.